Minister of Health Dr. Frank Anthony on Thursday said the investigation into the deaths of Vanessa Lewis-Sahadeo and her newborn baby girl have been completed, and based on the findings, immediate steps were taken to suspend the doctor and nurses involved. A maternal review committee headed by renowned obstetrician and gynecologist Dr. Neville Gobin conducted the investigation.
We have a standing committee called the Maternal Review Committee, and they had the opportunity of going there on Sunday, and they were able to interview everyone who were connected with the challenges that we had there. And they have since issued a report. And based on that report, we strongly believe that the doctor who was in charge of the patient seemed to be negligent. And we also believe that the nurses who was involved were also negligent. Based on these findings that was issued by this committee, I'm taking immediate steps to suspend that doctor who was involved in this case and two of the nurses who were involved.
The minister further stated that there will be several follow-ups to the investigation and further actions will be announced at a later date. Vanessa, from Williamsburg on the Corentyne coast, was admitted to the maternity ward of the New Amsterdam Hospital on February 22nd. 4 days later, she gave birth and subsequently underwent an emergency C-section. She was then rushed to the Georgetown Public Hospital following complications at the New Amsterdam Hospital and subsequently died on February 26th. The young mother, who had 3 other children, first visited the Port Morant Hospital after experiencing abdominal pains, but was transferred to the New Amsterdam Hospital since her blood pressure and blood count were low. Meanwhile, a post-mortem examination conducted by government pathologist Dr. Nihal Singh on Wednesday revealed that Vanessa died as a result of hypovolemic shock, which is an emergency condition that is caused by severe blood or other fluid loss, resulting in her organs shutting down. The post-mortem further stated that she also died as a result of abdominal and pelvic hemorrhage, acute lung distress, brain edema, and cerebellum herniation. One of her uncles, Joe Lewis, told the newsroom that her bladder was severed during the C-section. The uncle claimed that the doctors knew what had happened and tried stitching up the wound and further removed the young mother's womb. The uncle further revealed that the 2 autopsies were conducted on the newborn. The first postmortem, which was done at the New Amsterdam Hospital, revealed that the child died from newborn hemorrhagic syndrome. This occurs in a baby during the first few days of life. According to Boston's Children's Hospital, babies are normally born with low levels of vitamin K, an essential factor in blood clotting. A deficiency in vitamin K is the main cause of hemorrhagic disease in newborn babies. The newsroom understands that the second autopsy, conducted at the Georgetown Public Hospital, shows that the child was stillborn. Common causes of stillbirth include infections, birth defects, and pregnancy complications.